If you're on Social Security and disability benefits, listen up. I have important news about May 2025 Social Security payment schedule. When are your benefits going to be deposited into your bank account? And I have breaking news. President Trump just signed a long-awaited executive order on Social Security, keeping a campaign promise he had made last year. I am going to bring you details on how this executive order is going to affect you and your benefits. And then stay till the end of this video. I have news about Medicare, how you can save $1,100 a year on Medicare costs if you're turning 65 and trying to get on Medicare, or you're currently on Medicare. This is going to be information you would want to hear. Now, I am Kwame Kwade. I am an entrepreneur and personal finance expert. For 15 years, I've been creating content to help seniors get the retirement benefits they deserve. We started with websites on Social Security, Medicare, Medicaid, food stamps, and now we are adding video content. I am also an adjunct professor. I teach finance to graduate students at one of the most prestigious universities in the United States. If you're new here, hit the like button, hit the subscribe button. We do appreciate your support. And as always, I want to hear where you're watching this broadcast from. So do me a favor, go into the comments, let me know your city and your state. Now let's dive into this payment schedule and the changes that are coming up for May 2025. The first round of Social Security benefits up to $5,108 are headed out soon. It's important to know when it's going to hit your bank account. Now, there's a lot of misconception about the maximum amount of $5,108. That is not an amount that goes to everybody. It goes to the people who have paid the maximum into the program and have waited until age 70 to collect benefits. Those are the people that get the maximum, but it doesn't mean that everybody gets a tiny amount. There is a lot of money if you paid the maximum into the system. So if you're retiring at your full retirement age, which this year for some people is 66 and 10 months, and you pay the maximum, your Social Security check should be $4,018. And if you retired early at age 62 but paid the maximum into the system, then in 2025 you will get $2,710. But the average benefits, if you take all the Social Security benefits that are sent out and you take the average of it, it's $1,925. As I mentioned, the full retirement age is 66 and 10 months if you were born in 1959, and is 67 permanently, going to 67 for those born 1960 and above. So when can you expect your check in the mail for May? Well, as you may know, if you're on Social Security retirement benefits or Social Security disability insurance, which is SSDI, you're paid on based on your birth date. So if your birthday falls between the 1st and the 10th, you get your benefits on the second Wednesday. If your birthday falls between the 11th and the 20th, you get your benefits on the third Wednesday. And if your birthday falls between the 21st and 31st, your benefits, SSDI and retirement benefits, fall on the fourth Wednesday of the month. So what does this translate into actual dates? I'll tell you in a second, but let's talk about SSI for a second. If you receive supplemental security income, then your payments are on the first of every month, unless the first is a holiday or a weekend. And if you live outside the United States, you receive both Social Security and SSI. If your state pays for your Medicare premiums, or if you apply for Social Security before 1997, all these group of people get their benefits on the third of the month, unless the third is a holiday or a weekend. So now let's get into the actual dates. For May 2025, Social Security benefits will be paid on May the 14th, which is the second Wednesday if your birthday is between the 1st and the 10th. May the 21st if your birthday is between the 11th and the 20th, which is the third Wednesday of the month. And then finally, you'll get your benefits on May the 28th. This is really late into the month if your birthday is between the 21st and the 31st of the month. If you're on SSI, you will get your benefit on time on Thursday, May the 1st. However, for those of you who live outside the US, you're getting both SSI and Social Security. Your state pays for your Medicare premium, or you file for Social Security before 1997, your benefits will be paid on Friday the 2nd, because Friday, your May the 3rd, which is your original due date falls on a Saturday, so you'll get your benefit the Friday before. That is how that is going to work. Now, is there a second payment for May for some people on Social Security? Well, there is. Now, occasionally, when the first day of the month falls on a weekend or a holiday, the payment will go out on the last Friday of the previous month instead. This means that SSI beneficiaries, only SSI beneficiaries, are going to get a second payment in May on May the 30th. But this is for June. So know that your June payment for SSI will be paid on May the 30th. So people on SSI benefits are going to get two payments in May. The first one on May the 1st, which is Thursday, and then the second one on May the 30th towards the end of the month. Now, there's an important thing you need to know about overpayments. If you do not receive your benefits and you've waited 3 business days and your Social Security or disability benefit is not still in your account, you may be experiencing the effects of the new overpayment law or overpayment rule that was just implemented by the Social Security Administration. So let me walk you through what that means, so you have a full understanding of why your payments are being withheld. For Social Security overpayment identified after March the 27th, so it means that if the Social Security Administration decides that you are in an overpayment situation after March the 27th, 2025, the Social Security Administration will withhold 100% of your benefits until they have paid off the amount you owe. This rule does not affect those who are already on a payment plan with the Social Security Administration for an overpayment situation. Now, beneficiaries facing financial hardship, if you are caught up in this overpayment situation and you're facing severe financial hardship and you cannot afford for them to take all your benefits to repay the money back, you can apply for a waiver or even appeal the decision. But here's what you need to know. These are rarely granted. Waivers especially are rarely granted, and appeals take a while, and very few of them are granted, but it's worth a shot. But you have to know your rights, and part of it is that you can apply for a waiver if you're in an overpayment situation, or you can also appeal if you feel that the overpayment is an unfair thing that was put upon you. So let's talk about this breaking news that I'm talking about. President Trump has signed a long-awaited executive order on Social Security, one of the promises he made during the campaign, and he has delivered on it. Let's get into the details. It is the Preventing Illegal Aliens from Obtaining Social Security Act benefits. So I have all the details, and I'm going to share with you. There are fines that are involved that I think you should be aware of. So on April 15th, President Trump signed an executive order to prevent illegal aliens and other ineligible individuals from accessing benefits under the Social Security Act. The action applies to all Social Security Act programs, including retirement, disability, and supplemental income, which supports over 70 million Americans and distribute more than $1.5 trillion annually. The order responds to reports of ineligible recipients, including individuals over 100 years old with mismatched records and those using fraudulent Social Security numbers. The primary aim is to ensure that only eligible U.S. citizens and lawful residents receive benefits, safeguarding the integrity of the Social Security system and taxpayer dollars. A lot of people don't know this, but U.S. citizens and lawful permanent residents who have paid into the Social Security system can get benefits. Key measures to prevent ineligible payments. Federal agencies must take all reasonable actions, this is the executive order, to verify eligibility and stop payment to deceased or otherwise ineligible payees, including illegal aliens. The Social Security Administration's fraud prosecutor program will be expanded to at least 50 U.S. attorney offices. It means that they want to prosecute people who are found to be abusing the system, prioritizing areas with large undocumented populations. States and localities that fail to enforce eligibility verification may face civil or administrative enforcement actions. The SSA Inspector General is directed to investigate suspicious earnings reports, especially for individuals aged 100 or older, to combat identity theft and fraudulent claims. Over 6,300 illegal immigrants have already been stripped of Social Security and other federal benefits following the order. The SSA has moved Social Security numbers of flagged individuals to an ineligible master file, ensuring they cannot access federal aid again. And then there's a new identification technology. Advanced systems now detect anomalies in telephone claims and bank changes, requiring in-person proofing for suspicious activity. Then there's direct deposit. With 40% of direct deposit fraud linked to phone-based bank changes, these new measures aim to reduce an estimated 33.5 million in misdirected benefits from 2013 to 2018. What this means is that the Social Security Administration has identified that fraudsters are calling and taking over other people's accounts and directing their payment into other bank accounts using the telephone system. And so now the Social Security Administration is requiring a lot of people to make direct deposit changes over the internet. And if you cannot verify yourself over the internet, then you have to go into the Social Security office in person in order to do that. This is all aimed at protecting seniors from identity fraud that continues to grow. The SSA is considering, here's where the civil penalties come in. Fines are going to be issued to those who abuse the Social Security and disability system. The Social Security Administration is considering reinstating civil monetary penalties for individuals found guilty of Social Security fraud. These penalties can be up to $5,000 for each false statement or representation and up to $25,000 for each act of fraud or concealment. It means that if you're applying for Social Security or disability, you make false statements, you hide your income, or you don't report your income and you continue to get benefits that you don't deserve, there may be civil penalties that you can face. And then there's more. Medicare and Medicaid fraud prosecution. A new program will establish fraud prosecution for Medicaid and Medicare in at least 15 U.S. attorney offices targeting identity theft and beneficiary side fraud. And then prosecutors will be assigned first to the 10 regions with the highest population of illegal aliens, maximizing the order's impact. The Social Security Administration has publicly committed to implementing these measures to ensure benefits are paid only to those who are truly eligible. And then there's more. By eliminating fraudulent and ineligible payments, more funds remain available for current and future beneficiaries. So your question is, how does that affect me? How does that affect you in your benefits and how much you're receiving as a Social Security beneficiaries? A lot of people are looking forward to Social Security increases, and some of this money, President Trump and Elon Musk have said, some of the savings from these fraud prevention measures could be money or more money that's available for those who are currently receiving benefits. And so why should you care about all of this is because it could increase your Social Security benefits. And this has been publicly stated by Elon Musk and supported by the president that the goal of these anti-fraudulent measures may result in, and I use the key phrase, may, because Congress has to approve it, may result in higher benefits for existing beneficiaries if there's more money available because a lot of fraud has been eliminated. But there's a lot of ifs if they find a lot of fraud. So by eliminating fraudulent and illegible payments, more funds remain available for current and future legitimate beneficiaries, strengthening the Social Security Trust Fund. The order ensures that taxpayer-funded benefits go only to eligible individuals, reducing waste and abuse. These actions reinforce public trust in the Social Security system by demonstrating strong oversight and enforcement. And with 59 million seniors receiving retirement and survivor benefits, the order prioritizes the needs and security of American retirees. Now, the order also follows a February executive order that came earlier, ending taxpayer subsidization of open borders. This is the president's order talking. And this is all coming from the president's website, the White House, which I'm going to show you in a second. They're saying that more than 1,000 immigrants with criminal records or terrorist ties have been prevented from receiving benefits, highlighting the focus on national security. The order mandates cooperation between the Department of Justice, Labor, Health and Human Services, Homeland Security, and SSA for comprehensive enforcement, and the Social Security Administrator or the Social Security Administration's Inspector General will continue to monitor and report on program integrity, ensuring that these reforms are effective and sustained. So let me share some fact sheets. If you go in the White House, they have a fact sheet regarding this executive order. So let me explain in detail some of the highlights from the White House's own website on this executive order. It expands the Social Security Administration Fraud Protection Program, as I mentioned, to 50 U.S. attorney offices and 15 regarding Medicaid and Medicare. And it also makes sure that if you've heard reports about people over 100 years old claiming Social Security, this executive action is directed at investigating and eliminating that issue. And then we talk about civil monetary penalties that may come if you abuse or waste or you're determined to have committed Social Security fraud. And then there's policing Social Security Act fraud is critical because the act contains not only traditional Social Security provided to older Americans, but they're going to look at broader benefits, including unemployment insurance, disability insurance, Medicare, Medicaid, TANF, and other benefit programs. And then this is from the White House website. The Federation of American Immigration Reform calculated that American taxpayers spend at least $182 billion annually to cover costs incurred by the presence of 20 million illegal aliens and their children, which includes $66 billion in federal expenses, plus an additional $115 billion in state and local expenses. So the goal is to reduce this burden on the federal government. The Congressional Budget Office estimated that the Biden administration's open border agenda, this is from the website of the White House, which sought to provide Medicaid-funded emergency services to illegal aliens, has cost federal and state taxpayers more than $16.2 billion. So this is the context of what the president is doing and what is motivating this executive action. And then lastly, already his administration has stopped more than 1,000 immigrants with criminal records or ties to terrorist activity from receiving Social Security benefits. So this enforcement is already underway and ongoing. And so the benefit to people receiving Social Security is that you are going to get more benefits potentially if they find a lot of fraud and Congress approves Social Security increase because a lot of money has been recovered for the Social Security benefits program. So let me know your thoughts. What do you think of the executive action? Do you think it goes far enough, or do you think there's more that needs to be done to root out fraud, waste, and abuse from the Social Security system? Let me know in the comments below. Now, finally, if you're on Medicaid, you're turning 65, you already know you need to get on Medicaid 3 months before you turn 65 or 3 months after. You have a 7-month window to do that. But if you're currently on benefits and you don't like your benefits or you don't think you have enough coverage, I have great news for you. There's so many changes happening with Medicare. Sometimes it's very confusing to understand. There are some state actions like California is trying to do here to close loopholes, but have tried and failed. And so a lot of seniors find themselves in a situation where their Medicare benefits may not necessarily be that secure as they think. For example, this in Oregon, where 25% of plans are leaving, and then in Minnesota, where seniors face a dilemma whether to stick with doctors or their health plans. Why is all this confusion happening? Well, it's because there are over 24,000 Medicare plans out there. And as a senior, you have to decide every year to find the plan that is right for you, that fits your budget, covers you for what you need, and your doctors are in that network, your drugs that you need are covered, and so forth and so on. There's so many things to consider, which is why 90% of all seniors are in the wrong Medicare plan. So how do you pick the right plan that is good for you? Well, we have partnered with an organization that can help you do just that. Chapter Medicare makes Medicare simple for you to understand, for you to choose the right plan, and for you to use your Medicare benefits that you have earned. Why? Because it comes from a personal experience of one of the co-founders. One of the co-founders of Chapter Medicare had watched his parents struggle to navigate the process of choosing a Medicare plan and winding up paying premiums that were hundreds of dollars a month, more than they ought to have paid. He realized what a terrible experience the whole process was and decided to do something about it. That was one of the reasons why this company was formed. And their sole mission is to help you get into the right Medicare plan and save money. And one of the co-founders, an attorney, wrote one of the leading books on Medicare that's out there right now. And for him, it's about making sure that you know, let me read this to you. When I first started my job as a Medicare advisor, this is Ari Parker. I discovered that many Americans are getting misled into buying the wrong plans, Medicare plans, simply because no one took the time to sit them down and explain what was going on. So that is the mission of this company. Their services are free to you and they are unbiased because their agents do not work for commission. So they're not getting on the phone with you to sell you the most expensive plan to make the most commission. Their sole mission is to get you into the best plan that meets your need. And so I am going to tell you about their agents. If you go to their website, they have real agents these are the people you're going to be talking to. You're going to be talking about possibly one of these guys. You know, I mean, I just took a screenshot of a few of the agents that are on their website, but these guys are real and they are the people you're going to be working with. And here is how they'll work with you. Chapter will show you every Medicare option, including detailed information about which doctors, specialists, prescription drugs, and hospitals that are covered, what copay and cost, and how much your plans are. And then they'll compare it to traditional Medicare. And then you make the decision on which plan is best for you. So call them at 539-205-2147, or you can go to this website, askchapter.org/insider, or there's a description, a link to a page in our video description. If you go to the description of this video, there is a link that you can click on, fill out a quick form, and they'll reach out to you and help you get on the best Medicare plan that is available in your area for you. Plus, you can save $1,100 on average. So the service is completely free. It ensures that you avoid being one of the 90% of seniors that are in the wrong plan. So call Chapter now, but there may be a small window, especially if you're turning 65. There may be a small window for you to do this. And if you're currently on a plan and you want to switch, your window may even be shorter. So call them and see how they can help you get on the best Medicare plan. We have not partnered with any Medicare plan or any Medicare advisory company in the 15 years I've been doing this until now, because these guys are the real deal. They are rated highly by the Better Business Bureau, lots of 5-star reviews online, and they can save you $1,100 on average. That is a no-brainer. Call Chapter. And finally, if you want to stay on top of all the news that's happening, there's so much happening, executive orders, things happening in and out of Congress. It's hard to keep up on Social Security, Medicare, Medicaid, food stamps. It's really, really impossible to keep up, even for those of us who do this, every day. And so we've created a newsletter, benefitsinsider.co/subscribe. We're going to put the link in the description. And if you go to our YouTube channel and you go to the top of the channel, there is a link there that takes you directly to our newsletter. You can subscribe, and then we'll send you daily updates on what's happening regarding your benefits. So that's what I have for you today. I hope that you've had a great Easter. Today's Sunday is Easter Day, and I hope that you had a great Easter with your family. And I hope to see you tomorrow in another video. Thank you for watching.